The Kaiser Permanente healthcare workers are on day 2 of their 3-day strike. More than 75,000 workers across California, Colorado, and Oregon are calling for better pay and increased staffing. Eldina Hodzik joins me now. She's a licensed practical nurse at Kaiser Mount Talbot Urgent Care. Thank you so much for joining us. So just give us some understanding of what you're seeing in your day-to-day life that is making you strike.
Yeah, absolutely. First of all, thanks for having me. It's been rough the last couple of months. I feel like, we get to work. It starts off very busy. We end very busy. Oftentimes, we don't get off work on time. It's hard to get any kind of specialty care appointments, not just for patients, but for employees as well. And it's just time that something's done about that.
One of the demands is to improve staffing shortages. Help us understand what that means and how that's changed after the really tough period of the COVID pandemic.
We've been here, through the thick and thin of all the COVID restrictions and everything that we've had. I feel like, the shorting in the staffing shortage is due to just the lack of pay that they offer us. It's really hard to compete with the travel agencies and the rehabs around here. They pay significantly more than what Kaiser does. And I know that they offer, this great healthcare insurance benefits, all of the above, but that's not what gets the bills paid. And if the lack of pay could be improved, I feel like that would help bring in more nurses, more MAs, more everyone.
When you say travel agencies, are you talking about travel nurses?
Correct.
Yeah. Okay. So how then is the strike, do you think, affecting patients at this moment?
Their appointments are getting canceled. They're not able to come in to get seen for all the important things that they need as well.
But presumably when the strike gets done in the next couple of days, or at least this period of the strike, things will get back on track? Or do you think that'll be particularly difficult?
I imagine it'll be pretty difficult to try to catch up with everything that's been missed in the last several days. Because it's not just our location, it's all the other locations that have had to cancel all primary care, all specialty care, all sorts of appointments, the wait at urgent care, at the ED, everything's just much, much worse than it's been.
What's your feeling about Kaiser's relationship with its workers? I mean, has it changed over time since you've been there?
It's always been told that Kaiser has a great relationship with its employees. The whole golden handcuffs that they bring up. But after everything that's been going on, we're kind of showing that that's not so much the case, that it's more numbers and less employees that they care about.
And do you think 3 days of striking is going to be enough for the union to get what it wants? And what happens if it doesn't?
We're hoping so. We're hoping that it's enough. But if not, we'll go back into meetings and all that, and then we'll go from there. We'll see what happens. And I feel like us as employees would be happy to come back out here and, have our voices heard again.
Eldina Hodzik, thanks so much for being with us.
Thank you, guys.